Just trying to find the right moment to stop the music. But hello, everyone. I see we have 7 people in the audience right now. Thank you so much for coming, and I hope you all enjoyed the music as well. Just so you're aware, we are starting the recording right now. So with that being said, thank you for attending another webinar hosted by the Greenwich Hospital Medical Library. My name is Veronica Belenkin, and I'm the Consumer Health Librarian at Greenwich Hospital. Tonight's webinar is on managing chronic pain and where to find resources for learning more about it. And I'm very happy to be joined by Dr. Michael Foti. He is a resident physician who works here at Greenwich Hospital, and he specializes in osteopathic medicine, and he'll be able to help us raise more awareness about pain. Specifically in September, it is Pain Awareness Month. So thank you so much for joining me, Dr. Foti.
Thanks for having me.
Before we begin, I just want to let people know that there is going to be an interactive portion of this PowerPoint where I will be asking a question to the audience, and you have an option to use a polling software that I will introduce to you, or answer in the Zoom chat. It's just to give us a sense of what the audience already knows, and for us to see your responses, which is great, a great interactive thing, and is shown to engage the audience better. So I'm trying something new tonight. And also to save your questions for the end of the presentation, you may use the Zoom chat or the Zoom Q&A option at the bottom of your Zoom dashboard to make those questions, but please save them for the very end. So with that being said, I'd like to introduce us, the host and my guest speaker tonight. As I already mentioned, my name is Veronica. I'm the Consumer Health Librarian. I like to sum up what I do with the following quote: "I do not know things, but I can find them out for you." So as you can see, I have a master's in library science, and I also possess a consumer health certification. That means that I am able to find, share, and evaluate different types of information. With my job in particular, it is health information, and it is particularly important now in the digital age that it is an important skill to have, to be able to sort through all the advertisements, the misinformation, the deceptive marketing, especially when it comes to finding healthcare information. And I do this because I want to help the residents of Greenwich and the surrounding communities become better informed patients, better educated, and because I am a Greenwich resident myself, and I do really care about the community and the health of its residents. So that is my slide. I will move on to let Dr. Foti introduce himself.
Hello, everyone. So yes, I'm currently a third-year senior resident at Greenwich Hospital, getting my residency training in internal medicine. A bit about me: I'm born and raised in the Bronx, New York, so I'm local. I graduated from NYIT, College of Osteopathic Medicine, where I got my medical degree. That's out in Long Island, New York. And currently, I'm pursuing a career in medical education and primary care.
Great having you. And is there anything that made you want to specialize in osteopathic medicine in particular?
Yeah, so I graduated from an osteopathic medical school. The reason I had applied is I did have a family member who was also an osteopathic physician, and learning about it myself, I learned the philosophy, which I'll talk a little more later about on an upcoming slide, about how we are trained in a philosophy of looking at the person as a whole rather than our patients as a symptom of a medical condition, and how we use that in our learning about our patients and diagnosing them and treating them. So when reading about that and learning about it, I was drawn immediately to osteopathic medicine, and so I have a doctorate of osteopathic medicine. After graduating from medical school, you can actually attend and get accepted to and train in a residency in osteopathic medicine, getting further specialization, which I'll talk about a little later. And there's actually physicians who are trained in osteopathic medicine in residency as well. I myself am getting training in internal medicine, but do have training during my 4 years of medical school and getting a doctorate in osteopathic medicine.
Yeah, impressive stuff. I'm glad you're with us, you know. If you I think the reason for pursuing this is very admirable. So I'm glad that we have healthcare professionals such as yourself with those kind of
Thank you.
motivations.
Thank you very much. Yeah.
So just to give a brief overview for our audience, we already did the introductions, but the following slides are going to be organized as such. We're going to be defining chronic pain and the various types of it that may occur in somebody's life. They're also going over the types of pain relief and management that are most commonly recognized and maybe what your healthcare provider may prescribe to you or recommend if you visit them with regards to a painful condition. And as we talked about with Dr. Foti just now, he is very familiar with a specific type of pain relief known as osteopathic manipulative treatment, and he will be definitely going in detail about it during in that particular slide. With these particular webinars, I like to institute a 5-minute intermission or Zoom break. That's when both myself and I are going to be, Dr. Foti, I mean, are going to be turning off our cameras just for a 5-minute break for the audience's benefit. You may use the restroom to get a drink, just avert your eyes from the screen for a moment, and then we'll return afterwards to go over some online information resources on pain management that you may want to check out for yourself to educate yourself a little bit better, to prepare for a more productive dialogue with your healthcare provider, followed by book recommendations and a brief summary of the Greenwich Hospital's resources for pain management so that you are aware next time you visit the hospital, if you have some kind of condition involving pain, that's where you know where to go. Followed lastly by a Q&A session where you may ask either myself or Dr. Foti any specific questions you have on the topic of chronic pain and its management. And we have our first question for the audience. Please feel free to answer or not, but I would like to ask the audience what they believe is their personal definition of chronic pain, and what do you believe are some examples of that based on your own personal experience or where you've heard of that term referring to. I have two options for people. One is this really cool software called Poll Everywhere. I'm going to put the response link in the chat right now for anybody who wants to give that a try. So you can click on that and go to the response page and submit either your name or whatever you prefer to be seen as. And you answer the question there, or you can simply, if you don't want to go through all that, you can just simply answer in the Zoom chat this question. So I'm just going to give the audience a minute to respond for anybody who would like to. I know this type of software I'm throwing at you, you might be confused for a moment, but all you have to do is just click on the link that I posted in the chat. It's this one, and you're going to get okay, we got one response so far. So pain that you have all the time, sometimes worse, but always there. I think that's a pretty good response. I see Dr. Foti is nodding his head too, so he must approve as well. So thank you for that. Another person said that chronic pain is pain that one has all of the time. Okay, all right, sort of similar, interesting. Okay, what are some examples that people might think of when they think of chronic pain? Like if there is a pain that one has all the time, what part of the body might it be on, for instance? Oh, we have somebody who responded in the poll. Let me just quickly present that. So it looks like this for anybody who's curious. This is what the poll feature looked like. Thank you for sending your response there. I was always thinking about my knees. I don't always think about my arms. Yeah, so that, I guess you're referring to chronic pain with the knees and the arms. So that's one example. Spinal cord, knees, hips, shoulders, joints, intermittent pain that doesn't resolve, like hips. Okay, that's important. And neck. Oh my God, neck pain. I've definitely been there, and I don't think these Zoom webinars are helping personally because my posture is awful. But yeah, I think these are really great examples. I'm really happy that people are so educated. And I mean, unfortunately, that is not so surprising considering what I'm about to show you. I found some stats regarding chronic pain, and I'll post them right here from the U.S. Pain Foundation. It is that 50 million American adults, or 20% of the population, actually live with chronic pain, and that chronic pain, when studied, has been associated with a reduced quality of life, an increased risk of anxiety and stress, and is the leading cause of long-term disability. And it is unfortunate considering that despite these stats, funding for pain research is incredibly minimal considering the amount of people that are living with it, and is often undertreated in the healthcare setting. And perhaps Dr. Foti, if you have any comments, you can jump in and say, is there a reason perhaps that it might go undertreated in a hospital setting? Do you have any comment on that?
Yeah, I think it's difficult. Chronic pain it's a broad term. It envelopes so many different types of pain, and like our audience has mentioned, right? And there's joint pains, there's muscular pains, there's the list goes on and on. And I think that it's difficult in a hospital setting because so much is going on when one's admitted to a hospital, depending on why they're admitted. Um, and what's so important, especially for primary care providers, is sitting down one-on-one with our patients. And it takes one to really dive deep into someone's pain and really listening to their patients about when they have the pain, the character of the pain, how long, is it constant, is it fluctuating? And oftentimes in a busy hospital setting, it's difficult to get all that information because our hospital physicians have so much going on. And so I think it takes a deeper dive than what you can do in a hospital to figure out why someone's having that pain. And I think for patients too, there's so much going on when they're admitted to hospital, lights and sounds and what's buzzing and what's going on, and emergencies and whatnot. It's difficult to characterize their pain even for them when someone's in the hospital. So I think if someone is suffering from chronic pain, it's very important for them to talk to their primary care provider and really allow them to kind of delve deep into what's going on with their pain, and so that they can characterize it better and kind of help to treat, diagnose, and also direct them in the right direction of where they can get the best care for it. If not for the primary care provider, if they need a specialist, that something we'll be talking about, then so that we can direct them there.
And I mean, who better to tell us about the busyness of a hospital than a resident physician, I think I think it's important that the dialogue is both from the patient's perspective and from the healthcare provider's perspective, because we might not know what goes on the other side of the door, of the hospital door. So while it is clear that it might be undertreated, there are so many factors that come into play with regards to this. So your perspective is very valuable to people. And like you said, we will be going over a lot of the possible treatment options. So that's why webinars like these are so helpful. So of raising awareness. So with that being said, we are going to define chronic pain. A lot of you already did that for us. Thanks, audience. But according to a really great website, Medline Plus, defines chronic pain as any pain that lasts several weeks, months, or even years. We had a lot of people in the audience mention that. It's some pain that seems like forever. The origin may be unknown. It can definitely cause emotional distress or functional disability. And there are certain environmental psychological factors that can actually make it worse. I have a picture here that kind of helps me identify it. I think when I look at it right now, I feel like a lot of people who may have chronic pain in the audience might be familiar with that feeling of ugh. It's just a pain that you can see coming. It's just, it's going to come, and it's frustrating, and you feel like there's nothing you can do about it, but just endure it. So that's why ugh is just the common thing that I associate with it. And many people may be confusing it with acute pain, which is understandable. It is a pain, but it is known as a certain unpleasant sensation that results from a direct injury lasting a short time. Hence why the image that I chose to highlight, this one, is ow. It's something you say when it's something unexpected, or you might be doing something and not realizing it's going to cause you pain. like putting your hand on a hot stove. I'm gonna say ow. Just if you didn't know that was gonna give you pain, now you know. So hug and ow. That's how I remember the difference. For those of you who may have trouble differentiating the two, that's the way I do it. Um, I don't know if Dr. Foti agrees, but for my question for you is with regards to the difference between chronic and acute, and as we mentioned, chronic pain can last several weeks, months, or even years. When do you think people should start seeking treatment for it? Because we certainly don't want people to be enduring this for too long. But when do you think, in your medical opinion, should they start seeking treatment?
Yeah, I don't think the answer to that is clear cut, but I think that if you have an acute injury, obviously, if use your discretion, but if you feel like um, you've suffered an injury that needs to be treated immediately, you need to seek care urgently, obviously, in terms of the acute pain. And in terms of chronic pain, yeah, any pain that's unremitting and not resolving, despite conservative treatments, let's say it's not maybe very severe pain, but a nagging pain that doesn't seem to go away despite when I say conservative treatments, stretching, rest, ice, elevation, etc. And you're trying to treat it conservatively on your own, and it's not getting better, and it's the same or getting worse, you should seek care immediately to see what's going on.
Yeah, and but what it's important to realize is that whether it's chronic or acute pain, it's something that you should bring up with a healthcare provider no matter what. So,
Yeah,
if it's something like a cut, or bruise, obviously that can be treated at home. But if it's some kind of pain that obviously, whether it's acute or pain or chronic pain, if it's something that keeps you from doing anything in your daily life, probably needs to seek help for it. So,
that is another important factor, and I think someone in the audience mentioned that as well. If it's affecting your quality of life of your normal activities, even your hobbies, if it affects anything like that, then yes, you should seek care immediately.
So some people may look at these images, and we did hear from the audience the types of chronic pain that may be most common. The most common, when I researched, appears to be migraine. Oh, wait, oh, for some reason they were supposed to come up on the bottom, but it's headache and migraine, neck and back pain, osteoarthritis, and TMG. So those were the most common ones listed when it comes to people being admitted in hospitals. I believe it was the CDC's Bureau of Health Statistics that mentioned this. But there are different chronic pains that involve abnormal nerve signaling processes such as fibromyalgia or IBS. When people came in to describe their pain, it's with regards to it being chronic, they mentioned it aching, burning, shooting pain, squeezing pain, stiffness, stinging, throbbing, lots of descriptions, as you can see. There's even a chronic pain that can be psychogenic, caused by psychological factors such as depression, anxiety. So a lot of broad spectrum when it comes to types of chronic pain, clearly. Dr. Foti, is there a similar process for diagnosing these types of chronic pain, or is it different depending on the type?
So yes and no. So in terms of those ones listed on the top, for headache and neck and back pain and arthritis, TMJ, those are diagnosed differently. Headache is very dependent on the history that our patients tell us. Basically, it's very important to describe to us, and I'm going to talk about this a little later too, but the character of your pain as you listed there, aching, burning, etc., throbbing, what time of day do you have your headache, the severity of the headache, what makes it worse, what makes it better, is it constant, is it waxing and waning? These are all very important details for headache. So the history is actually a very important point for headache, whereas something like neck and back pain, meaning musculoskeletal pain, yes, the history is extremely important, but then also the physical exam, and that guides physicians into the next steps after the physical exam in terms of diagnosing. Do we need imaging, or is this something that we're able to diagnose on physical exam, et cetera. And that kind of goes along with arthritis as well. If we're suspecting arthritis, there's additional imaging needed here, et cetera. Whereas the bottom half listed there, the pain that is described by abnormal nerve processing, fibromyalgia, irritable bowel syndrome, psychogenic pain, these are diagnoses, what we call diagnoses of exclusion, meaning there's no specific test that can diagnose these syndromes. So when someone's coming in with pain, and physicians, as always, create what we call a differential, meaning what on our list are we considering might be causing our patient's pain. And fibromyalgia, IBS might be on our list, but we need to first exclude other causes of pain that we can diagnose either by imaging, et cetera, or physical exam, before we say, okay, this is fibromyalgia. Because again, there's no specific test that can diagnose it. And so that's what we call them, diagnoses of exclusion.
That's a really important point. I hate to think that somebody would be researching this online and come across fibromyalgia the way that, when you go on WebMD, everything you search up somehow leads to cancer, So it's important to know that, just because you might have pain might necessarily be something as severe or long lasting as fibromyalgia. That's the important part. And we keep emphasizing going to your healthcare provider and starting this dialogue will start the process of actual diagnosis. So that's really important to know. And with regards to these psychogenic depression and anxiety, I suppose that's where you could bring up with a specialist like a psychologist or psychiatrist, not necessarily a physician. Not sure if you would know.
Well, I think the conversation would start with your primary care provider, right? So after they've excluded other diagnoses, and they, together, again, it's kind of something that's shared between the patient and their physician. If they feel that this is something that might be psychogenic, meaning due to anxiety or et cetera, then the primary care provider can then refer them to speak to someone. Again, after first excluding other diagnoses.
So when in researching this from the Association for Chronic Pain, the Stanford Medicine Resource Guide actually brought to light what's known as the pain cycle. And it brings to light for people who may not have a chronic pain or who are suffering from chronic pain. If the chronic pain is not treated and persists, patients can be stuck in the pain cycle. Which meaning that this image might be a little bit confusing. So I simplified it to the right here. Every time the pain is felt, the muscles will involuntarily spasm or guard to protect the body. And the minimizing of the movement will eventually restrict the range of motion for some people, which may cause over time muscle weakness and atrophy. And after that point, decreased function can actually impact the ability to live everyday life, which can lead to the psychological distress that was mentioned in those stats that I put in the first slide. One of the biggest, the people who suffer from chronic pain are often the most risk for suicide, unfortunately, because over time, if it is not treated, or as we keep mentioning, if it's not brought up to your healthcare provider, you continue to suffer. This might be the unfortunate outcome. So, Dr. Foti, do you have anything to add to this slide?
Yeah, I think it's an important slide. I think that it speaks about if someone's suffering from a pain in a certain area and it's either left untreated or it's, despite treatment is not improving, they tend to compensate. If let's say for this is some sort of musculoskeletal pain, they tend to compensate by, let's say, kind of favoring the other joints of their body. Let's say it's on one side, favoring the other side as they walk, etc. The body is naturally going to compensate by trying to relieve pain from that area. So then now, you're not strengthening that area now because you're not really using it. And now you're compensating all of your energy on another side, and now you're affecting another side as well. It's actually a big part of what we focus on with osteopathic medicine too, is that's why you have to take the whole body into the picture. If someone's having knee pain. Well, is it because of the knee, or is it really because they have an injury with their ankle or something going on with their ankle that now they're compensating, and that's causing them to put more pressure on their knee, for an example. So to look at the big picture, that the body's going to compensate. The body naturally wants to self-heal. The body always will try to heal itself, and so that's part of the mechanism, is that it will, these compensatory mechanisms will be enacted. But that's why it's so important to not leave pain untreated, and to seek care for it.
And I think the more people are aware that this cycle exists, the more likely they're going to be able to seek help. So I think that's important. That's why it's so important to be aware of, and why I dedicated this slide to it. So we have, moving on to the treatments, that's what we're going for. But I'd like to ask the audience just one last question with regards to what they believe are the current treatments for chronic pain. Some of them might be surprising. When I looked into it, I was certainly surprised by some of them. I'm going to put up the poll again. It's the same thing. I'm just going to put the link in the Zoom chat right now. Let me see. It's right here. So, and again, for those who don't want to use the poll, you may certainly answer in the Zoom chat any current treatments that anyone in the audience might be familiar with, whether they've had chronic pain themselves and have seek treatment, what was that treatment, and or if you've heard about it on the news or through your own research. I'd like to know what the audience currently knows about it. Okay, we have someone who says physical therapy and medications. All right, good answer. The choices we have in the poll, movement. Okay, that's another one. The choices we currently have in the poll are medication only, spinal cord stimulators, yoga, or all of the above. Okay. Yep. All right. So we got all of the above for the poll. Okay. Oh, we got a lot here. Interested in stem cells, muscle relaxants, Tylenol, drug, and SAIDs. Oh, okay. Somebody knows the proper terminology. That's great. So okay. So primarily it was all of the above, I think. I don't know why it's not showing up now, but I did see all of the above for there. So 100%. Acupuncture, anticonvulsants. I have not heard of that one. And PT, physical therapy, I'm assuming. So great. All right. I think we got a lot of great treatments in here. But for those who answered the poll, the correct option was yes, it is all of the above. And we will be mentioning them in the next few slides. All of these treatments deserve their own slide, if we're being honest, but we're going to go step by step based on specific categories. So the first one we're going to go through are the types of pain relief and management that are more pharmacological in nature. And those would be non-opioid pain relievers. Somebody mentioned in the audience the exact terminology, NSAIDs and acetaminophen. And we also have antidepressants and the much maligned in the press opioids. That includes fentanyl, oxycodone, morphine, and many other types. I actually have a list of the types available for anyone. If you click this link, it will take you to the CDC's website on opioids with really detailed descriptions on each type. We have pain relief and signs of addictions website from familydoctor.org. The National Institute on Drug Abuse has a great resource when it comes to looking up that specific drug information. Dr. Foti, I'm sure this is a very common question from your patients who might be asking or seeking pain relief. If they are prescribed pain medicine, what are the risks and benefits, briefly, for each of these drug options? And also, how likely might addiction occur if prescribed?
Yeah, I think it's a great question. I think that, with pain, I think, again, it depends on what's the cause of the pain, right? And because NSAIDs and acetaminophen are more so for inflammation. And acetaminophen specifically is also helps with fever. It also helps with headaches. Um, we, as primary care providers, always like to go in a stepwise fashion and starting with both non-pharmacologic means, which we'll get into, as well as the lowest pharmacologic means first, meaning NSAIDs and acetaminophen, and work from there to see if that can first relieve our patient's pain before going, step up and going into the stronger pain medications. The risk with NSAIDs is that you want to be careful with that in terms of the duration, because you should never be using NSAIDs for a longer course. It should only be in short courses, because NSAIDs can can increase your risk for basically damage to the lining of your stomach and cause stomach ulcers. It's it's one thing that if you're using NSAIDs, it only should be the prescribed amount or the amount that's on the, if you get over the counter packaging, and only for really for a short course, because it can affect your stomach in that respect and increase your risk for getting again, affect the lining of your stomach and increase your risk for stomach ulcers. Acetaminophen, you really just want to be careful of how much you're taking and for how long. You always want to follow the instructions on the over-the-counter packaging. Opiates, of course, are the ones that have an addictive potential on the list here. We never like to prescribe opiates unless absolutely necessary, because obviously there are certain types of pain that, if severe enough, may require that, especially in hospital. If someone has very severe pain from a fracture, or let's say severe pancreatitis, et cetera, and they absolutely need an opiate in hospital, we do provide if needed. On an outpatient basis, I'd recommend, some primary care providers are comfortable prescribing opiates if it's absolutely necessary. Again, I myself personally, with their addictive potential, first of all, in our resident clinic, we don't prescribe opiates. But going forward in my practice after I graduate, I'd be weary to, and probably would not, just because of their addictive potential. I'd rather refer someone to a pain management specialist who is more attuned to, who knows, the risk involved of how to manage chronic pain, and also, again, we'll talk about more of the interventional pain management specialists that we have that are, I think, are great at what they do and help through procedures, help patients avoid having to even go on opiates, or having patients get off of opiates if they've already been on them. So we'll talk a bit about that too, but yeah.
It's good to know that opioids is kind of like the sort of last resort, it seems, in
Mhm.
case, but after every other option has been exhausted. You kept mentioning the unless absolutely necessary. So what conditions would fall under absolutely necessary when making medication the primary pain relief option? If you want to go into detail about that.
Yeah, again, I think that speaks probably more to opiates, and obviously, like I said, in hospital, if someone's having severe excruciating pain due to whether it's severe trauma, fracture, pancreatitis, etc., that requires opiate pain medications for relief. Also, people who suffer from pain from cancer oftentimes are on opiate pain medications, so they are used and employed. Again, I favor having a pain specialist involved who's more tuned to how to prescribe them, because there is actually, there's mathematics even involved with how to, dosing opiates, etc. And so yeah, so again, they are certain times necessary, but I think having a pain specialist involved is key as well.
Yeah, so it's definitely a lot of factors involved. So people who are coming to the hospital and expecting, right away medication being the first option, I think
Mhm.
we're gonna have their mind changed now, because we are gonna go over the less commonly known types, which are the no drug treatments. We've got physical therapy, which a lot of people mentioned in the audience, so clearly they're aware. We also have the whole spectrum of complementary and alternative medicine, such as acupuncture, massage therapy, herbal medicine, mindfulness, and Reiki. While the research may be slim on it, there is a whole website linked here just describing, for instance, fibromyalgia. There's a whole page there talking about how studies have, the very minimal studies have been shown so that the people who are deficient in vitamin D might be more susceptible to fibromyalgia. So some people recommend, some healthcare professionals, particularly on this site, recommend that people uptake their dosage of vitamin D. So that's just one example of complementary and alternative medicine. Acupuncture, for instance, is often recommended as a complementary thing to cancer treatment, the effects of cancer treatment. So that's an example as well. We also have surgery as an option. The most commonly one that I seem to get research requests for is for spinal fusion for instances of chronic back pain. Then we also have injections and nerve blocks. And last but not least, sort of like the more high-techy sort of new wave kind of needs a lot of research and sort of experimental stages of high-tech interventions. Radio waves, spinal cord stimulation, regenerative medicine therapy. There's so much to unpack there. Each of them, like I said before, each of them kind of deserves their own PowerPoint slide if you think about it. But Dr. Foti, could you tell us a little bit about the benefits of those that you do know, which is physical therapy and injection nerve blocks? What are their benefits with regards to pain management?
Yeah, I think, physical therapy, I'm sure many of our audience are aware of. I think it's important in terms of one of our main non-pharmacological means of treatment for pain, specifically musculoskeletal pain, joint pain. Oftentimes, unless there's a acute or severe injury, if someone's dealing with chronic pain from musculoskeletal cause, such as chronic low back pain, we often employ physical therapy, and it does work wonders for many of our patients. And but we're aware as primary care physicians that we track our patients and see how they're doing throughout their physical therapy and see if they're improving. If they are, then that's wonderful, of course. And if they aren't, then further workup obviously is needed depending on what type of pain we're talking about. So I think that's great. And it's a great non-pharmacologic tool to be able to get patients off of medications, even if they are NSAIDs or any stronger type of pain medications. And then in terms of injections and nerve blocks, we're going to talk a bit about it a little later, but there's a great specialty called interventional pain management that we do have. It's one of our Greenwich Hospital departments that are physicians that are trained to perform procedures for certain types of pain, such as nerve blocks, where they basically can, block the receptors affecting that specific type of pain and help our patients avoid or get off of opiate pain medications if they have severe pain. It depends on the type of pain, the location of the pain, and whether it is amenable to a nerve block or injection. Again, I leave that to my interventional pain management colleagues to delve in further with, but it's something to discuss with your primary care provider. Know whether, depending on the type of pain you're suffering from, whether that is a referral that you benefit from. And of course, you can always reach out to their clinic as well to get more information.
And would those injections, so one example of that would be something like injecting cortisol, I believe, or some kind of steroid with regards to arthritis pain. I've been hearing people talking about that with regards to injection. Is that what that's referring to, correct?
So steroid injections can be performed by many different physicians, even orthopedic physicians, sports medicine physicians, etc. The pain management physicians, interventional pain management, do very specific, spinal injections and nerve blocks, very specific to certain types of pain. And again, it depends on the location of the pain to see if it is amenable to a nerve block or not.
So again, while we are creating a brief overview of it, I will be sharing some resources later on where you can delve more into the info regarding each specific type, including the high-tech interventions, which we don't have time to go into today. So with last but not least, we have these what's known as self-directed types of pain management. I kind of like to refer to them as sort of DIY. You can do it yourself from home. It can be supplementary to whatever your healthcare providers prescribes, whether it be medication or one of those previous options from the previous slide. They include light exercise. I have a link here from the National Institute of Aging that talks about the 4 types of exercise that can improve your health and physical ability. A lot of great stuff. It can be for any age, honestly, but what I like about those links in particular is that it's emphasis on light, you know. It can be an activity that you enjoy, such as swimming, you know, walking, hiking, not intense hiking, but just something that gets you moving. Next, we have relaxation techniques. Mindfulness has been a really common thread, even before the pandemic, as a way to decrease stress. And it's also recommended here for chronic pain, as chronic pain, we talked about earlier, can cause stress and anxiety in someone's life. So doing something like yoga, tai chi, or just meditation, maybe, you know, making that a part of your day is recommended. I actually have another link here for relaxation techniques and mindfulness examples from the ACI Health. And last but not least, there is a growing field of study on nutritional changes that can be made to your everyday life, known as an anti-inflammatory diet, with foods as in vegan and Mediterranean diets. I actually researched a few times for somebody who came to me for gout. I had his healthcare provider told him to look into changes in his diet, such as eliminating salty foods, getting in more vegetables, and especially getting rid of any kind of red meat, or, you know, severely limiting it, as opposed to what the quantity that they were doing before. So those are some examples. Dr. Foti, with regards to the light exercise, I know that there may be some people who may be hesitant to do that, especially if their chronic pain is intensified during exercise. Do you have any kind of recommendation with regards to being able to pursue light exercise as a means of pain management in that case?
Yeah, I think obviously it's you know, as we tell our patients, activity as tolerated, right? So it depends on the pain that you're having. With any pain, obviously, continued movement is always good because you're keeping your joints moving, and you're you know, improving your circulation, and those are all good things for pain. Obviously, as so much you can tolerate. In terms of, let's, you know, for example, a chronic pain syndrome such as fibromyalgia, if someone was diagnosed with that after having ruled out other diagnoses, light exercise, specifically aerobic exercise, is actually one of the recommended treatments for fibromyalgia. And it does actually help quite a bit with that type of pain syndrome. So yes, as much as you can tolerate, it is definitely recommended. You know, it goes along the lines of recommending physical therapy as well. So yes, as much as you can tolerate, it's quite helpful. Yes, for sure.
And now we're going into your specialty. I believe we would put this under the category of what was it? The no drug treatments, correct? That would be your specialty of osteopathic manipulative treatments. So I will leave it to Dr. Foti to get into this. I'm sure I don't know how many people in the audience are aware of this, but it is quite fascinating.
Yes. So again, there's a whole medical school and doctorate. You may or may not have a physician who is a DO, and may not be aware that your physician is a DO, because so osteopathic medical schools, where you can get a doctorate in osteopathic medicine, are all over the country and growing. So to speak about that first before I get into the philosophy, an osteopathic medical school teaches its students everything that a allopathic physician or an MD learns, and take board exams just as MDs take as well. with the added training in osteopathic medicine. Um, After getting a DO or a doctor in osteopathic medicine, you can then either pursue residency in any specialty, such as myself. I'm getting trained in internal medicine, but you could pursue any residency, including residency in osteopathic manipulative medicine specifically. So there's a lot to it. This was 4 years of medical school, but if I can briefly talk about OMT or OMM is basically it's based on a philosophy of mind, body, and spirit, which we believe are all interconnected and everyone in our daily lives. Um, we describe it as a holistic approach to medicine. So we are trained throughout our 4 years and looking at our patients as a whole person and not just one symptom, right? So even when someone comes to us with specific pain, as I was mentioning earlier, say our patient's coming in with hip pain, we're trained not just to look at the hip. You should be looking at their knees, their ankles, their shoulders, everything, because their hip pain may not be due to something in the hip. They may have hip pain, for example, because maybe there is a what we call we use a terminology that's called somatic dysfunction, basically dysfunctional misalignment or what have you in another joint, let's say a knee, your knees or your ankles, that is causing you to compensate abnormally as you as you walk or any other type of movement, and because of that compensation, it's causing you to have hip pain. And that just is one minor example of how we look at, again, the patient as a whole person and not just that one symptom, right? And in doing so, we're trained to diagnose and treat quite a wide variety of diseases with a hands-on approach. We use our hands to diagnose not just musculoskeletal conditions and pain, but although we are very trained in that as well, but also other causes we call visceral conditions, right? So the lungs, the heart, the GI system, etc. And we can help diagnose and treat many conditions in all the organ systems, neurologic conditions, etc. And those physicians who go to residency and get even further specialty training, osteopathic medicine, can then go and practice it in their private practices, etc., or in a hospital setting. And so I encourage you, if you are suffering from chronic pain, to seek out these physicians because they do wonders. I worked with many osteopathic physicians in my training. I've seen patients who went from being debilitated and really unable to walk at all to saying, "Oh, doctor, I can dance now," because they have been seeing this physician for so long and they've been treating them. My medical school, NYT, works with many patients with Parkinson's disease, and so they can treat many conditions and help quite a bit. So I do encourage you to even just do your own research more than I can tell you here briefly on a slide. But I can tell you that it's employed for a wide variety of diseases, and as a whole, it's a philosophy. I think it's wonderful, and so I definitely encourage you to do your research and to seek out these doctors.
Yeah, a lot of great stuff. And I do have 2 links that were provided by Dr. Foti and myself down here for those who want to seek more information. Before we continue, Dr. Foti, I just wanted to quickly ask, this particular treatment, is there like a set amount of time that somebody has to visit to get these hands-on techniques done on them? Is there a program that's individualized the way that physical therapy is? Like what will people expect is like the commitment to this treatment before they see the results?
Yeah, it's definitely not a one visit type of thing.
Of course.
It's like you said, like physical therapy. You schedule, with your physician, multiple visits, and it's over time that they treat you. It's definitely not in one visit for sure, but they work with you for that, and they may space out the visits as your condition improves, but yeah, it's definitely over multiple visits.
Hmm. So again, there was more. I wish we could go into more detail about it because it sounds fascinating, but this is a brief overview, as we said. The more information can be discussed, found here, and you can discuss this option now that you're aware of it with your healthcare provider if you know you or someone you know is suffering from chronic pain. So with forward, we have only 3 minutes left in the presentation, so I'm just going to fast forward a little. On the various websites that I'm going to show in the next slide, they have these tools for communicating pain level. So when you do arrive at your healthcare provider and want to talk about chronic pain, sometimes it can be hard to explain the type of pain that you're going through or the level that you're going through. The bottom screen right here is probably what you're familiar with. You know, a scale of 0 to 10, no pain being 0, unimaginably, unspeakably painful being 10. But sometimes you need a little bit more detail. You can access this chart from the American Chronic Pain Association. Goes into a little bit more detail. For instance, it has a rating scale from 0 to 10, but for different categories. For instance, is it from a scale of 0 to 10, how difficult is it for you to get up out of a chair or out of bed? So it goes into more details like that. So when you talk to your healthcare provider, it can eliminate to him or her what is causing the pain and what activities causes you the most pain, for instance. Then we have a pain management plan handout that you can take to your healthcare provider and go over what strategies or any of the treatments that we talked about you want to explore as options. And last but not least, from the cancer.org website, there is something known as a pain diary, which is something that you could work on with your healthcare provider. And when you do start a treatment plan or a pain management plan, you're able to track the progress of it and see over time how if your pain is decreasing or increasing or staying the same. So it's almost like you're tracking your calories for weight loss. You're going to track your pain scale as you're progressing through treatment. So these are the links that you can investigate in your free time. And with regards to the online resources that I mentioned, I highlighted the main ones that I think would be the most helpful and are the most comprehensible and user-friendly for people to do their own research on any of the subjects we talked about tonight. It's Medline Plus, this chronic pain page, the US Pain Foundation, the American Chronic Pain Association, which is where that handout was that I just showed, the Pain Consortium from National Institute of Health, and I mentioned in the no drug treatment section for pain management, the complementary health. That is where, this is the site where you would go to. And what's great about tonight is you're going to find out a website that I currently manage that has all of these links listed out very neatly. It is the Dr. Stephen Mickley Community Health Resource Section website. And I will just quickly show you what that looks like. And it froze again. Hold on. I don't know what's going on with my links today, but I will just get out of there and do it manually. So this is what the Stephen Mickley Community Health Resource Section looks like. This is the site that I manage. As you can see, there are multiple very easy to read categories. So under health topics, if you're looking for pain management specifically, you go to health topics, and then pain is listed right here as the option. And all of the websites that I just listed in the PowerPoint are here. And we even have quick links to the pain reliever section, to chronic pain web pages, head pain, back pain, and specifically for fibromyalgia. And we do have a print collection here at the library. We cannot check out books to visitors at the moment, but these are what we have currently in our collection so far, that you may look for in another local library of your choice, or be able to check out when we are alleviating our visitor policy. And we are adding new ones to collections so soon, so you can come back to this website and check it out. And if you or someone you know have missed this webinar's recording, I will be posting the recording of tonight's webinar in this section under the category of webinar recordings. So it's going to be down here in where to find. So you go to this box right here. After in a day or two, I'll get the link for it and I'll post it here, and it'll be listed as where to find chronic pain, managing chronic pain resources. And then I was asked for book recommendations by someone to include this in this webinar. So these are some of the choices that I found online. They are current, they're written by medical professionals, and they have great ratings from users. So I tried to make it broad to more specific, and also to include some of the no drug treatment plans that we talked about, such as yoga for pain relief, mindfulness solution to pain, and using acceptance commitment therapy to ease chronic pain. So take a look at your leisure. And last but not least, we have pain management at Greenwich Hospital. There is a center for pain management. That is the number down there. And I've also linked the web page on the Greenwich Hospital website with more information on it. I'll list it on that webpage. It simply states that the diagnosis for pain will involve an in-depth questionnaire and complete physical exam, and that patients should be prepared beforehand to bring all past test results, any evaluations from other physicians, a list of all current and past medications and their side effects. So keep that in mind when you visit this Center for Pain Management, that's what you need to bring. So thank you so much for coming. That is the end of our presentation, and we will definitely be taking questions now. I'm sorry that we're a little over time. Dr. Foti, are you able to stay just a little bit longer in case people have questions?
Of course.
Okay, great. So we're gonna see if somebody has a question right here. Is turmeric helpful? Specifically if you go on the National Institute of Complementary and Alternative Medicine, that'll definitely be able to answer your question. So if you go to my website again and we go to pain, the National Center, okay, here we go. So I should have linked it here, I think. But I can just quickly go in here and show you how to look it up. Institute of Complementary Medicine, that's what it's called. And you can look up for yourself in the search bar or in health topics or herbs at a glance, turmeric. So if we look it up right here, I don't know specifically for pain management, but here, if you go on this website right here, that's where you're able to find information on turmeric, the herb itself. Dr. Foti, do you have anything to add with regards to turmeric?
I don't. Unfortunately, I don't have much experience, and I'm unaware of any evidence behind its efficacy. But I'm glad there is a website. So definitely encourage our audience to read into it more. But I personally don't have any background in that.
So next we have, is there any dosage of NSAIDs which can be taken safely for months? For example, 500 milligrams of naproxen with food twice a day. I think I'm going to leave that to you to potentially answer.
Yeah, unfortunately, I would say no. Yes, obviously, twice a day dosing, and there are certain NSAIDs that have like twice a day dosing, which is less than, let's say, like an ibuprofen, which people often take, a little more frequently. But I don't recommend any long course for an NSAID. Like I said, just because of the damage it can do to your stomach lining, I would only recommend very short courses of NSAIDs. And if a very short course of NSAIDs isn't helping you, then I encourage you to see your primary care provider again to seek further workup if needed.
And it can be short in terms of like, it can be started and then stopped, but then started again if needed, right? Or
yeah, well, yes, but I would say if you're failing a course of NSAIDs, again, this all depends on the type of pain, where the pain is, etc. Is it musculoskeletal? Again, NSAIDs are anti-inflammatories, so they're really going to help with pain caused from inflammation, right? Arthritis, specifically osteoarthritis, musculoskeletal pain specifically. So, but if you're failing a short course of an NSAID, then you'd have to see your primary care provider to see, what else can be done. Maybe would you benefit from physical therapy, etc. It all depends on the type of pain.
Now we have another question. Where can we rewatch this session? So I'm just going to show you. There's 3 options. You have my website, the Dr. Stephen Midley Community Health Resource section, which I've linked in my PowerPoint right here. And it's going to be in the webinar recordings section. So I do not have it right now because we are currently recording it, but I should have the link in the day or so. And I'll be posting it here. It's also going to be on YouTube. If you go to the Greenwich Hospital's YouTube page, and it's under the medical library playlist. So I have it linked there as well. It's going to be posted there in a few days. So it takes a little bit longer to render these videos onto YouTube. So you'll be able to also watch it there on that playlist. And it's also going to be posted on Greenwich Hospital's social media pages. So just watch out, maybe in like the next couple of days or possibly next week, there's going to be a posting of the live session as a social media post. So that's that. Hopefully that was clear. Next we have a person asking, I have been diagnosed with fibromyalgia. The pain intensity changes all the time. Is there a reason for that pain intensity changing?
Yeah, so unfortunately, it's difficult to answer. Fibromyalgia and the kind of mechanisms behind it are something that's still being studied to this day. We don't have a great grasp on the mechanism behind fibromyalgia, unfortunately. Hence why, I talked about earlier why it's called the diagnosis of exclusion. We don't even have a specific test because it's a complex type of pain syndrome. So I wish I could answer that. Unfortunately, we don't know why. But I encourage you to keep a pain diary like Veronica mentioned earlier. That's something to definitely share with your primary care provider. When you get the pain, how frequently, when does it get worse, when does it get better, and discuss options like light exercise, which I mentioned earlier, which does help, can help with the pain, of course.
Yeah, I was about to suggest that as well. The pain diary from the cancer.org section doesn't have to be cancer related, but it can just be pain of any kind. I can actually open it up so we can maybe see what it looks like. If it'll work. Yes, it works. So this is what the daily pain diary looks like. So you're rating your pain, and then you can print this out or write directly on the computer, the date and the time, the pain score of 0 to 10, where it feels and how it feels, what it was. It gets very specific. So it kind of asks you what you were doing, what's the kind of medications you're taking, any non-drug techniques that you tried. So you can try any of the ones that we talked about tonight, see if that makes any difference, how long the pain lasts. So over time, you may see some changes, you may not, and that's something that you can, then this is some tangible evidence that you can bring to your healthcare provider to be able to assess better maybe why these pain changes in intensity for your current condition. So hopefully that was helpful. Next, we have another question regarding medication. I take Tylenol extra strength several times a day and Tylenol PM. How much and how long can I take this medication for? I am going for PT for a torn bicep tendon and neck issues.
Well, with Tylenol, you want to follow, the recommended dosaging that's on the over-the-counter packaging, only taking it as frequently as it recommends. I'd be careful in knowing how much you're taking in terms of if there's a different dosage for the Tylenol extra strength versus the Tylenol PM, and always be aware of how much you're taking in a 24-hour period. I think if you add it up, it comes to, you want to be less than like 4,000 milligrams in a 24-hour period, I believe. It should be less than that. If you look at the over-the-counter instructions, but regardless, be aware of that. And then if you're taking up to that, I wouldn't take that for too long of a period, especially if it's not helping. And obviously, physical therapy hopefully will help your pain and help you to kind of take less Tylenol as you work with physical therapy. And I see another question, is aspirin effective for
Mhm.
pain? So aspirin is a type of NSAID, but oftentimes it's more often employed for primary prevention in terms of reducing your risk for cardiovascular disease. Oftentimes your physician, if he's going to recommend an NSAID, they might more likely recommend, ibuprofen, or for example, naproxen, as opposed to aspirin.
Yeah, I'm glad you're here for the medication questions because all I really know is what it says on the back of the bottle. So when it
Yeah.
and I think you're right regards to like the liver problems and it might, stomach problems that might ensue from, overdosing yourself, unfortunately. It can offer, but I understand the appeal. It can offer a quick solution, but I think the treatments that we talked about, like physical therapy, non-interventional stuff, can kind of help you in the long run, even if they might not satisfy your need to get rid of the pain right away. So
Yes.
we have another one talking about, I took gabapentin for back and neck pain. How long can it be on that particular medication? I'm not familiar with that one. I have a recommendation for an app actually that's free on your iPhone and Android. It's called drugs.com. If you look that app up, it has very detailed descriptions of any prescription over-the-counter drug that you can think of. So I think what would behoove a lot of the people that are asking the medication questions, you can go on to drugs.com. You can see the dosage level. You can see the side effects. You can see just what it does in general. It's recommendations because that website and app specifically, it says it's been vetted, that information by medical professionals and pharmacists. So that website is very accurate with regards to its medication information. So I'd recommend those people maybe check that out as well. So I don't know if you had any thoughts on that particular medication, Dr. Foti.
Yeah. So those, and there's a question about why wasn't it's a medications for nerve pain or neuropathic pain like gabapentin, why we hadn't discussed it. That is another one of the pharmacologic treatments for, but specifically for, like you mentioned, nerve pain or neuropathic pain. Again, it's yeah, what I agree with Monica. Going on that website may be able to give you more information about that, but also pain specialists often employ those often as well, and might be better able to answer that as well in terms of when it's needed, in terms of specific nerve pains, and how long they would normally prescribe that.
Yeah, so as you can see, I'm showing right now, it is a website as well, and you can actually make your own account so that you can make your own medication list there. But as I looking up this one, a gabapentin, I believe I spelled it correctly. So it talks about the warnings, what it is, what you should know before taking it, how should I take it, and the specific dosing information. So it really goes into depth here. So it even talks about what happens if I miss a dose, what to avoid, side effects. Like I mentioned, sorry about all the red boxes, but I just wanted you guys to know how dense the information is here. So if we are not able to go into information about it, there's definitely a website just for free that you can access where you can get all that information for yourself. Somebody asked, is a DO like a combination of an MD and a chiropractor?
No. So now osteopathic physicians do have certain maneuvers and treatments that are similar to those that physical therapists do employ, but all of the training that we do get has a physiologic and clinical background to it that we get in training over 4 years. So it's there's more to it, and it's a different type of training for sure.
Okay, I think that's about it. Is there any other questions for Dr. Foti? We don't want to keep him, but he seems to be really at ease with these type of questions. So I'm glad, that's why I'm really glad he's here. But in the meantime, while somebody may be thinking of a question, just so you know, you can register for more free and upcoming webinars on the Greenwich Hospital events page, and you by calling this number as well. Again, the link for my website is here if you don't want to type out the long title, Stephen Mickley Community Health Resource Section. But if you type that, that's going to be the first option on Google. And my next webinar is going to be October 12th. We have another physician as our guest speaker. It's going to be on hospital preparation suggestions. It's the same time, 6 to 7 p.m. on October 12th. Feel free to register on the Greenwich Hospital events page for that webinar. And if you have any questions that we didn't get to tonight, feel free to email me. That's my email down there. And also when I'm available from 9 to 4 p.m. Monday through Friday. And I'll be able to look this up for you, maybe even get in touch with Dr. Foti if I need help with it. So thank you so much, everybody. I'm sorry we went a little bit over time, but I really hope that you got something out of it and that we were able to answer your most pertinent questions about pain management and chronic pain. So with that, I think we're going to adjourn. Have a great night and thank you for attending.
Thank you
so much, Dr. Foti.
No, yeah, thank you, everyone. Wonderful questions. It was a pleasure. Thanks so much.